we know that stroke is a major cause of cognitive impairment. There's an interesting interrelationship in that cognitive decline is also a recognized risk factor for stroke. There are variable estimates of the proportion of people who are affected by cognitive impairment after stroke, and there's limited information when it comes to looking at things like socioeconomic factors, ethnic diversity, geographical representation, in that most studies come from a single area rather than across a nationality. So we were keen to look in more detail, not just at the total number of people affected by any degree of cognitive impairment after stroke, but also at the trajectory of change and how that relates to things like severity of the stroke, type of stroke, other factors about that individual, and whether we could refine in more detail risk factors that would enable a more personal approach to be taken that would then influence things like planning healthcare, planning for future rehabilitation. So that was in essence the study. It was funded by the UK Stroke Association and also in collaboration with the British Heart Foundation and the Alzheimer's Society. So I can say a little bit about that study. So it was initiated in 2018, and we aimed to recruit 2,000 patients from around the UK after stroke, and we were able to get 50 centres. There was huge enthusiasm for the study. So in the end we had 50 centres from across all of the UK, and we were actually able to recruit almost 2,500 patients in the end. Obviously this happened across COVID, so like many other studies that have been presented here, we were affected by COVID, but nonetheless we were able to over-recruit. It's a predominantly milder stroke population, so it reflects stroke survivors, and if you like, that's relevant because cognition in the long term is highly relevant to that group of people. And we found that about 50% of people have some degree of cognitive impairment if you assess them shortly after the stroke, like within the first few weeks. And then if you assess them again at about 6 to 12 weeks after the stroke, you find that their cognition has improved to an extent. And then there's a gradual decline thereafter with increasing numbers of people who would be then clinically classed as having dementia or cognitive impairment that falls short of dementia. We confirmed some of the risk factors. So for example, stroke severity is a risk factor for any degree of cognitive impairment, even if you look at a very mildly affected population, things like increasing age, premorbid dependency. Interestingly, some other factors were less well, came out less clearly. So for example, in the past, lower education has been recognized as a risk factor, but we didn't see that. So we're still digging into it. We're still looking at things like socioeconomic factors and so on. But I think it's actually quite a powerful resource. We were able to retain almost 95% of the people in the study over the 2 years. So there's always problems with missing data in stroke studies, but we hopefully have tried to minimize that. The other main point is that all of the outcomes at 1 and 2 years were done by remote methods, so phone or post, and it also shows that you can do very large studies with a cognitive outcome that you do the follow-ups by remote means. So I think that's quite an important point as well.